Okay, good morning, guys. I'm Dr. Prasanna. Today's topic of discussion is malaria in pregnancy. Okay, so we all know that malaria is caused by four types of plasmodium, uh, like plasmodium vivax, ovale, malaria, and falciparum, right? So these plasmodium, it undergoes so much of cycle inside our body and it converts and it shows the symptoms. Okay. Generally, most of the plasmodium takes about 48 hours. Much 48 hours. So that is a tertian fever or tertian malaria. Only one plasmodium takes about 72 hours to complete the cycle. Okay, that is plasmodium malaria. Plasmodium malaria. It's a big one, no? 72 hours. That is quartan malaria. Okay, so we all know malaria means we get fever, chills, tiger, headache. Not only that, even jaundice. Okay, jaundice is also a sign of malaria. It's not a complication. Generally, people land up in jaundice in malaria. Okay, so now we learn in detail what is malaria and if a pregnant lady gets malaria, what should we give, depending upon type of which plasmodium is been infected inside the body. Okay. Um, yes. Uh, Hope you people can see my point. Right? With it, malaria, right? Malaria. So malaria is caused by a protozoa. Okay. So protozoa and this falciparum, ovale, vivax, all of these take, okay, all of these take 48 hours. All of these take 48 hours. Whereas malaria take 72 hours. Malaria take 72 hours, right? Okay. So, if a pregnant lady got malaria, then the fetus will have risk of miscarriage. Like pregnant lady can abort this fetus, or there can be a preterm labor. There can be congenital malaria. Even the baby can get malaria. That is known as congenital malaria. Okay, because the placenta can also get this plasmodium, and through placenta the baby can get malaria. Okay, so basically we'll tell about awareness. We'll create awareness. We'll tell that you should have a bite prevention by keeping all the nets, deep prophylaxis and all. Okay. So chemoprophylaxis, if they say that what kind of chemoprophylaxis can we take? Okay, chemoprophylaxis is we can give mefloquine. You know, mefloquine can be given. Okay, in mefloquine that is also about 5 milligram per kg body weight. Okay, 5 milligram per kg body weight once a week. For example, why we should give a chemoprophylaxis? For example, in a house all people are suffering with malaria continuously, and there is a pregnant lady in that house. So this pregnant lady can get a chemoprophylaxis with mefloquine, that is 5 milligram per kg body weight once a week. Okay, and there is a casual prophylaxis as well. Okay, casual prophylaxis is mnemonic is CHAP. Okay, CHAP 7. CHAP 7 is C is casual prophylaxis, which is given hepatic phase, and it is given for 7 days. And AP is Atovan, Atovanon, and Proguanil. Okay, so this is given in case of hepatic phase, that is a casual prophylaxis. We all know now. First, there is a erythrocytic phase, then followed by a hepatic phase. Plasmodium goes and cycle returns again, from hepatic phase to erythrocytic phase, right? So in this hepatic phase, we'll give this Atovanon and Proguanil. Whereas in case of erythrocytic phase, okay, in case of erythrocytic phase, it is known as sequential prophylaxis. That is known as sequential prophylaxis. In erythrocytic phase, for sequential prophylaxis, we'll give mefloquine. Okay, so mostly whatever I told in the previous example, mostly these all people in this house will be mostly in erythrocytic phase. Okay, that's why we are giving mefloquine. In that way, in sequential or erythrocytic phase, we'll give mefloquine for 4 weeks. I said mefloquine will be given dose 5 milligram per kg body weight weekly once. For weekly once for how many weeks? 4 weeks. Okay, understood? So in a house, if many people are having malaria and there is a pregnant lady and she wants some chemoprophylaxis, then you can go for mefloquine 5 milligram per kg body weight. Weekly once for 4 weeks. Weekly once for 4 weeks, right? Perfect. Now, now there is a see. We know some drugs in malaria, right? Generally, we'll prescribe as medicine. People will prescribe Primaquine for malaria, but in case of pregnancy, Primaquine, Primaquine is contraindicated. Is contraindicated. Generally, in case of G6PD deficiency, this aggravates the G6PD deficiency. So primaquine is contraindicated mostly in all pregnancies. We won't give primaquine because primaquine has a teratogenic effect. It can cause congenital cataract in the fetus. That's why we won't give primaquine. So what to give? What to give if there is a lady came? So until now I told how to prevent malaria. Now a lady came, pregnant lady came, and she's having malaria. She's diagnosed with malaria. Then what you can give? So options are primaquine is not there. Then you can give quinine, or you can give clindamycin, or very important famous drug that is chloroquine. Okay, chloroquine. You can give that. Okay. So this quinine, what is the dose of quinine? It's about 600 milligram. Quinine is 600 milligram. Will give for thrice daily. Okay, thrice daily will give. Even chloroquine is 450 milligram. This is also thrice daily. Okay, totally a 1 week course. 1 week course. So pregnant lady came with malaria. So you can give quinine 600 milligram thrice daily. So clindamycin 200 milligram thrice daily for 7 days. Okay. If a lady came and you prescribe this, and this lady says that, ma'am, I took clindamycin 450 milligram tablet, and within 5 minutes I vomited. What should I do? Okay, within 5 minutes I vomited. What should I do? If she says, ma'am, I took the tablet almost half an hour passed. Now I got vomiting and I vomited the tablet. Then, for that case, if 30 minutes pass, for that people, you'll give half of the dose. Understood? So, clindamycin or quinine, whatever dose, like for example, clindamycin 450 milligram tablet she took, and within 5 minutes, within half an hour she vomited, then you'll repeat the dose. And if more than 30 minutes she vomited, then you'll give a half dose. You'll give a half dose. Perfect. Mefloquine. See, people will say that, see, you already treated her, but you also need to continue the chemoprophylaxis. Okay. So the thing is, you started a quinine, you started a clindamycin, and after that, for 1 week dose, after 1 week, like after 7th day, on 8th day, better give mefloquine. Better to give mefloquine. You know, mefloquine, what is the dose? What is the dose, Mohan? Mefloquine, 5 milligram per kg body weight. 5 milligram per kg body weight, right? Do you remember acyclovir dose in case of herpes? We'll give acyclovir, right? That is also 5 milligram per kg body weight. Even mefloquine also 5 milligram per kg body weight, right? So people says that you can give mefloquine on the last day of the therapeutic dose. Okay, therapeutic dose of we are giving clindamycin or something. On the last day, you give on the last after 1 week you give this mefloquine. Okay, so you know the symptoms and all I already told. And what is a method of diagnosing malaria? That is thick and thin smear. Okay, that is thick and thin smear. We can diagnose malaria by means of thick and thin smear. That is a gold standard diagnosis. And symptoms is fever, chills, jaundice, headache, and fever. Right. What are the complications of malaria? If a pregnant lady got malaria, what are the complications? She can land up in anemia. She can have cerebral malaria. She can have cerebral malaria. Her glucose will be lost, will be decreased. That is known as hypoglycemia. And she can also have hyperparasitemia. What is hyperparasitemia? This is very important. Okay. Hyperparasitemia means a RBC. A single RBC have more than 2% of parasites. There are more than 2% of parasites in this single RBC. There are more than 2% of parasites. That is known as hyperparasitemia. That is the complication of malaria, right? So, a pregnant lady came and she's having malaria, right? Uh, Whether it is less malaria or more malaria, whatever malaria, you'll admit the patient. What you'll do? You'll admit the patient. If she's uncomplicated malaria, you'll admit the patient in the hospital. If she's complicated malaria, then you'll admit the patient in HDU. Sorry. Okay. So that's what. So, in case of uncomplicated malaria, you'll hit with the patient in hospital. In case of complicated malaria, you'll hit with the patient in HDU. You'll hit with the patient in HDU. Okay. So basically, whatever malaria question is there, then the first option should be admission. Okay. So, in case of complicated malaria, complicated malaria, IV drugs will give. IV obviously artesunate. Artesunate is the first line. Okay. If artesunate is not available, then you can give quinine also. Okay. That's it. So basically, I told chloroquine can be given or quinine clindamycin can be given. So this chloroquine is given in case of plasmodium worm. What is worm? Vivax, ovale, malaria. Okay. Whereas falciparum, in case of falciparum, you will give quinine clindamycin, right? Okay. If it is complicated, then you can go for artesunate. If it is complicated, then you can go for artesunate IV or IV quinine. Okay. So for this malaria patient lady, you'll send CBC, LFT. You'll send clotting factors. Okay, every 24 hours, every day, every 24 hours, you will repeat that because she can land in anemia. Okay, she can land in anemia. That's why we'll see. Even she can land in jaundice. That's why we are repeating this. And lefty, she can have DIC. She can land in DIC. So for that, you are finding out this clotting factors in LFT. Okay. So how do you know that baby been affected? Okay. How do you know the baby been affected? After birth of the baby, you will send the sample of placenta for histology. You'll send the sample of placenta for histology. Okay, in histology, there will be we can see any parasites. Okay, that is the one thing. And second thing, this umbilical cord sample of the blood or baby blood samples you will send every weekly, right? Every weekly you send the blood sample of the baby for at least 1 month or 28 days. For at least 28 days you'll send. So month of placental cord blood sample, another weekly for 28 that days means another 4 samples. So total 5 samples you'll send to find out whether the baby been affected with malaria or not. Okay, that's very important. So now let's see some questionnaires scenarios. Okay, a 27-year female came. She's pregnant and she's 32 weeks. How much? 32 weeks. Okay, she's 32 weeks and she's having falciparum. That's it. There is nothing there, given no complications, nothing. So in case of falciparum, I already told the combination one, that is quinine plus clindamycin. Quinine plus clindamycin will give. Second question is a 27-year-old female with 32 weeks of gestation and she's having Vivax. She's having Vivax. Okay. In case of Vivax, what will do? It's a worm, right? Worm means you'll give chloroquine. Chloroquine. Okay. If chloroquine resistant, then you can give mefloquine. If chloroquine resistant, then you can give mefloquine. Right? How to rule out malaria? If thick and thin smear, you whatever you did, if it is negative, what if you say there is no malaria? At least three negative samples should be there. At least three negative samples, and that to 12 to 24 hours apart, you need this sampling test. And if all the three samples are negative, then it is negative. There is no malaria, right? Okay. And in malaria, remember one thing, there is everything is 50%, like 50% chance of IUGR, 50% chance that efficacy of nets, 50% chance there is mortality with pulmonary edema, 50% chance of fatality with falciparum, 50% chance that DEET can work. In that, everything can be a 50% thing. Okay. Now let's see some of the algorithms and we'll see, right? Okay. So a lady came, you're suspecting malaria. So a lady came, you're suspecting malaria. right? A lady, you're suspecting malaria. She's having history of fever. She's having history of travel. Okay, and we should assess that. Okay.